going to go ahead and call the meeting to order. We'll try to get Commissioner Anderson when we can. So I will call the meeting to order, and I will ask the clerk to take roll.
Commissioner Marecki?
Here.
Commissioner Dobb?
Here.
Commissioner Anderson? Commissioner Baker McCormick?
Here.
Chair Colleen?
Here.
You have a quorum present.
Thank you. Before we move on, I want to suggest to the committee, if it's okay with everyone, we have a rather lengthy report. Is that available to everybody right now? Outline from the HHS? Well, from the department. Does everyone have that outline that they can follow along on what the report's going to be?
Yeah. Oh, yeah, now we do.
Everybody does, okay. What I'm going to suggest here is a way, because there's a lot of stuff here, and we're going to be covering a lot of things. There's about 7 different sections to the report that administration gave us. What I would like to do, just for organization and keep moving along, is at the end of each section, we'll let people present their section, then we'll ask questions. What I would like to do is first I'll just go around the horn on the table, and I'll first go to the vice chair for any questions she has, and then we'll just go over like we normally sit, go Anderson, Commissioner Dobb, and Commissioner Marecki, and then I'll do any a back cleanup in case there's some questions that weren't asked yet. Is that acceptable to the committee as a way to go about this?
Yes, it is with me, Marecki.
Okay, yeah, I just want to make sure. And then after, if there's any, when we get to the end of each section too, and committee members have had their questions, we'll see if any other commissioners that are attending the meeting also have questions. So that's the way I intend to proceed. Next on the agenda, Madam Clerk.
The approval of the March 10th, 2020 meeting minutes.
Pleasure of the committee.
So moved, Marecki.
Support Anderson.
Oh, Commissioner Anderson, welcome. Any additions, corrections, changes to the minutes? All in favor of the motion, please say aye.
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 Aye. Anybody opposed? Okay. Next on the agenda, Madam Clerk.
The old business, there is none.
Okay.
Item D1.
Go for it. Okay. Here under D1, I'm actually going to take the second one first because we have Dr. Schmidt from the ME's office. Lot going on over there. So at this point, and I have had that agenda that you see, the report that you see from the department as a result of a couple of conversations that I have had with administration in terms of what needs to be reported on, what we need to know, soup to nuts. There's a lot of stuff in there. But I would first like to go to Dr. Schmidt to give us an update on what's happening at the ME's office. So Dr. Schmidt, if you're ready to go, please give us your report.
Okay, I'm ready. I thought I would put things into perspective with some numbers. In March of last year, in other words, March 1st, 2019 to March 31st, 2019, we had 1,441 death reports. That is, those are people that actually get called into the office. We give them a case number. That's for a number of reasons, and not all of them are brought into the office. From March 1st of 2020 to March 31st of 2020, we had 1,596. So it was a small increase, but it was well within the monthly error that the variation that we get from year to year. On the other hand, from April 1st, 2019 to April 16th, 2019, which is the time period that I did for both 2019 and 2020, So in 2019, for those 2 weeks, more or less, we had 620 death reports, whereas this year we had 1,346. So the number more than double. But remember, those are the people who get called into the office, most of whom are released and not actually brought into the office. So as far as the cases that are actually brought into the office, in from April 1st to April 20th of 2019, we brought in 169 cases into the office. And from April 1st to April 20th of 2020, we brought in 246 cases into the office, so that we brought in 77 cases more. So that was a 45% increase over last year over the cases that we actually see in the office. Most of those are still pending because we don't have enough information, or we are doing lab testing to determine the cause of death. But this increase in cases brought into the office is going to end up being due to more natural deaths. And many of them are not necessarily due to COVID-19 disease. But I think that before I go into that, there's something I need to put into perspective, and that is that this is on top of a regular caseload. So for example, in those first 3 weeks of April of 2019, we had 18 homicides, and this year we've had 23. And it looks like we're having the same increased numbers of drug deaths. So quarantine considerations aside, the kinds of circumstances that bring cases into our office are really not changing. So that excess 77 cases that we're seeing are due to mostly older individuals dying at home.
That's enough meeting for me today, Lord.
As far as COVID-19 cases are concerned,
there is one. There's a health meeting that's on now, but I'm not on that committee.
as far as COVID cases are concerned,
Can you all mute your phones, please? Make your muted, because we're getting a lot of feedback.
okay, can you hear me better now?
Yes, thank you.
Okay. Of the natural cases that we've tested, we have tested 70 cases for COVID, or for the virus that causes COVID-19 disease. 40 have come back positive. We have autopsied 13 of those. It wasn't always evident that there were going to be COVID-19 positive. And something that I think is important to highlight is that in many of our regular cases, like there are some homicides that have turned out to be COVID-19 positive. Same thing with some accidents that we managed to get tested that were not due to drug use. And I think what this highlights is that the prevalence of the disease in the community is much higher than we think it is, because it's appearing on cases that actually died for other reasons. And I think that is essentially it as far as my report goes. There is really not much to say, but I'm sure that you have questions.
That's it. That's what you have, Doc?
Yes.
Thank you for that. So we'll go around on the questioning, and I'll start with Commissioner Baker McCormick. You have the floor.
Thank you, Mr. Chair. As far as the virus is concerned and pre-existing conditions, have you been looking at the numbers of death deaths for those that have the virus, and also looking at the numbers that have pre-existing conditions that may have helped to cause their death?
Almost all the cases due to natural disease that we certified positive, that was certified with COVID-19 had pre-existing conditions. The most common condition is obesity and then heart disease.
And do you know if there was a documented history, or is that what you're finding after the fact? And what I'm asking is maybe this could be someone that didn't know that they had a condition. Say, for instance, a 40-year-old that passed away due to the virus. And it's being said that they're not really sure why. Are you finding that once you do the autopsy that then you find out that yes, there was some other condition?
Well, as I said, the majority of them were obese, significantly obese. Other than that, like other pre-existing conditions such as heart disease and lung disease, I think that those people knew before they died that they had those conditions because we had history from the scene that they had medication, or they had a doctor's prescription, or they had gone to visit a physician. I think that those individuals that were obese, that died from COVID-19 disease, were otherwise healthy up until the point that they acquired the virus. I think that obesity causes a number of problems in a person's ability to breathe, especially when they have COVID-19 disease, which is why we're seeing it so often in cases that did not otherwise have pre-existing conditions.
Okay, and so in the African American community, we have we know that there's a lot more cases of people that are contacting and also dying from the virus. And we know that in other communities, non-African American communities, there are people with pre-existing conditions. However, we don't see the same amount of devastation due to death or even contacting the virus as we do in the African American community. And I'm just wondering, as you're doing your autopsy, is there anything in particular that is more prevalent in African Americans that would say that this is why this is happening more in our community?
I think if there is any one answer to be derived from our exam, it's obesity. Almost all the cases that were COVID-19 positive had significant obesity associated with them.
Okay, but there's obese individuals in every community, so that's why I'm trying to understand how the pre-existing conditions might have an impact on the African American community versus pre-existing, in this case, obesity in other communities. So
I can't answer that question because many of the deaths, most of the COVID-19 deaths have actually been certified in hospitals. We get a segment of the population that doesn't have access to care or is otherwise underinsured. And I think that other than obesity, if there is one factor that I think is associated with COVID-19 mortality, is lack of access to care.
And are you saying the lack of access to care is a cause of their having their pre-existing condition, and then when they get the virus, it's a domino effect, basically?
No, obesity is a pre-existing condition. And obesity is actually a complicated problem that has many reasons for it. I think that aside from obesity, I think lack of access to care is a significant reason for these individuals' mortality, because most of them did not seek medical care before they died.
I see. And the last question has to do with record keeping and long-term research, so that when this is over, or for lack of a better term, when the cases of the virus decrease, is there a way in which we can first make sure that the data is gathered, is maintained, and also that in the long term we can dig and dive into this a little bit deeper, so that we clearly understand how to deal with a pandemic in the future?
Well, our data goes into a database called Case Manager, which has been maintained by the county since, this version has been maintained since 2007, if I remember right. And the positive finding of SARS-CoV-2 is actually a separate field that we created in the database. So it is fully searchable.
And so do you keep the, I don't know, like specimens, or do you keep any of the physical data? Not just the, entering it into a case management program. Do you keep any of the actual physical
tissue?
evidence? Yes.
We keep tissue in formalin for 2 years. And for every case we do, and that's every single case, we also take a couple of drops of blood and put them on a piece of filter paper, which is then dried, and that's also archived as part of the deceased's record.
Okay. And so when you, and this is the last question, but when you're dealing with the hospitals, you just said that you don't get all of the cases. And so can you explain that process? If you're not getting those individuals, what happens?
Those are not medical examiner's cases. Under Michigan law, if a patient has a physician to certify the death and they die from natural disease, they don't fall under medical examiner jurisdiction. So that most of the deaths that are occurring in hospitals are not even reported to us. They're just certified by the physician because the hospital documented through a number of means, such as the medical record, laboratory testing, and so on, that they were a natural death. So they are certified directly by the hospital.
And so they don't, you don't work with the hospitals at all. They basically have their records at the hospital and you have your records. They're
right.
Separate. Okay.
That's right.
Thank you very much. And thank you for all the work that you're doing. Thank you.
Well, thank you.
Thank you, Commissioner Baker McCormick. Commissioner Anderson, do you have questions?
Yes, I had unmuted, but I was going to just ask a little bit of a follow-up from that question. I know Commissioner Baker McCormick got into a couple of it, but I didn't hear anything about nursing homes. I'm assuming that it's the same situation with nursing homes as it is with hospitals. If a doctor comes to the site, or someone trained is able to determine cause of death. I don't know, do they automatically do testing for COVID at those facilities, and or do they report those back to at least our health department?
Any testing would be reported to the health department and would also be documented in the Michigan Disease Surveillance System.
But they don't necessarily make their way to you, right?
Correct. The vast majority of them don't, because they're natural deaths.
Right, okay. That's all I have right now. Thanks for what you're doing too. It's got to be a tough job.
Thanks, Commissioner. And we're going to have more discussion in nursing homes coming up in another part of the report.
Okay.
Commissioner Dobb?
Thank you, Mr. Chair. I just have one quick question regarding your capacity. There was an article that came out in the Detroit Free Press earlier this month about bringing in refrigerated trucks to hold the bodies. Is that happening, or where are you at with capacity and getting the bodies to funeral homes?
We have room for about 300 cases. And today our census is 223. We have the refrigerated trucks because this is not like a mass fatality event that everybody thinks of as a mass fatality event, like a plane crash, for example. In some ways, the irony, I think, is that would have been easier to handle because everything happens at one time. But this is an increase in mortality over a prolonged period of time. And there is a limit of two things happen. One is that there is a limit to which the funeral homes can actually handle the removal of cases. And the second one is that a fair number of those individuals will eventually end up being unclaimed. So that we have 3 refrigerated trucks, not because we need them at this very minute, but because as more deaths happen to this, and you've already seen how this is increasing the daily caseload, a greater number of those will end up being unclaimed individuals. And it may be that we may run out of capacity in our own storage space and have to start storing unclaimed remains in the refrigerated truck. There is another time lag to this, and that is the time that it is required by the state to approve the disposal of unclaimed individuals. And that can be a significant time lag, which also puts a strain not just on our storage long term, but also on the funeral home's ability to dispose of those unclaimed remains.
Okay. What is the timeline for the unclaimed remains? How long do you have to hold them?
We don't actually have to hold it for more than 2 or 3 weeks. As soon as that time is up, we start. We actually start the process for processing the paperwork.
Okay.
About once or twice a week after that time, we also try to follow up as much as we can with individuals, and we actually keep track in our database of the people that we have contacted and the efforts that we have made to contact individuals.
Okay.
Another factor in unclaimed remains is that you don't know that someone is unclaimed until the day that they're not claimed. And by that, I mean that many families who may be financially unable at the time of the death will not actually pay for the funeral, and they ask us to hold onto the body for some time while they put together the resources for burial.
Okay. All right. Thank you. That's all I have.
Thank you, Commissioner. Commissioner Marecki, questions?
Yes, thank you. Thank you, Mr. Chair. Yes, thank you, Doctor, for the report. I just want to make a comment, and you brought this up. And I think this is something that from the very beginning could have skewed a lot of these models we're seeing, and that's we do not know what the denominator is of this disease. And you pointed that out, that people that are dying from murders or accidents are testing positive for this. And, you know, some are asymptomatic. And so I think that was just a very good point, that we do not know the denominator of this. And that is something that really needs to be considered as we move forward, like opening businesses and all that. We just have to look at the whole picture and not focus on things that we don't necessarily know. So I just wanted to thank you for that. Thank you, Mr. Chair.
All righty, thank you, Commissioner. Any other commissioner on the line that has a question for the ME's office? Any other commissioner with a question for the ME?
Yes, Mr. Chair, I just had a clarifying question.
Please.
Thank you. When you talked about the testing results going to the health department, and you also talked about a database, a disease control. Can you talk about that a little bit more in detail?
COVID-19 is now a mandated reportable disease in the state of Michigan, so that every case is reported to the health department and to the state, both by the lab doing the testing and by us when we receive the test, if it hasn't already been done so.
You said something about a department, I guess, that deals with the health department and a disease control or database, or?
Oh, the database, the Michigan Disease Surveillance System, Communicable Disease Surveillance System. Yes, that has been in place for many years. And it's a database that keeps track of all the diseases that are reportable, or actually have to be reported under the Michigan public health statutes.
And again, what is the name of that?
MDSS.
MDSS, and it stands for?
Michigan Disease Surveillance System.
Surveillance Systems. Okay. Thank you.
You're welcome.
Yeah, thank you, Commissioner. That system is what the governor's task force on disparities is going to be looking at. That's where they're going to primarily get their data, is all that reporting. So everybody reporting into that system, it's vitally important. Doc, do you have enough PPE over there?
We have the PPE that we need for now. The university is providing us with PPE, but like everybody else, we're getting it as we need. But
the University of Michigan is providing you?
Yes.
Yeah, and just for other commissioners, the contract now with the ME's office, the medical examiner is the only county employee over there. All the other employees are University of Michigan folks. We've had a contract for the University of Michigan for a while now to manage the medical examiner's office. You got enough people? You're good with staff?
Yes, we're still looking for pathologists because they're very hard to find. But we're managing okay as we are now. And by the way, I'm not an employee of the county. I'm appointed by the county, but I'm actually an employee of the university also.
That's correct. You are appointed by the county. So yes, in that sense, you're our only employee. Thank you for spending time today with us, Doc. Good luck over there.
Sure. Okay, thank you.
Thank you. I think I'll move on, and we'll go to the individual reports. If people can refer to the outline that was provided for us. I think what I can do, and some of the questions that were just asked about recording data and all that kind of stuff, I think we have our health officer, Carol Osterberry. Are you there with us, Ms. Osterberry? As we wait for people to unmute. Do we have Ms. Osterberry with us? I'm not hearing anything. I'm not hearing anything.
Can Andy, if you're on the phone, can you call Carol?
Yeah, I already did try to get a hold of her right now. So maybe if we have some other.
Let's go to the next section of the report then till Ms. Osterberry is with us. And I assume Ms. Allen, the COO, is on the line, Janelle Allen. Maybe not. Okay.
COO Allen has indicated that she is on. I don't know if there's some technical issues right now. Just text me that.
Yeah, that's what makes these kind of meetings so fun.
Maybe if Sherelle can unmute everybody and then everybody put themselves on mute because Janelle may be on mute.
Yeah.
Hi, this is Janelle Allen.
There you go.
Yes, okay.
This is Carol
is on
Osterberry.
also.
Okay, we have Ms. Osterberry now.
Yes, but if you don't
Hear me?
mind, if I could just maybe, I don't know if you have some background, but this is Janelle Allen, the Chief Operating Officer with the County Executive's Office. And as Commissioner Colleen has said, we do have a really broad, a comprehensive overview, because as we were preparing, we realized that it's been 6 weeks, almost to the day that we came before you with an update about coronavirus, and now known as COVID-19. And at that time, you may recall, actually, the day
I'm sorry, Ms. Allen. Anybody
Yes.
that's on the line that is not speaking, please put it on mute. It'll make the meeting a lot better. I'm sorry to interrupt you, Ms. Allen. Please go ahead.
Thank you. And the day we presented actually turns out to be the first day that we received our first positive case in Wayne County, and I believe actually in our state. And as we know, that was 6 weeks ago, and as we all know, our world has completely changed since then. So as part of our, it's been a while, a lot has happened. As part of our update, we said, I know that you all have requested, in particular with the Public Health Division, who clearly is on the front line of leading our response, but there are a lot of different areas throughout the department and over the Senior Services Department that have also been directly involved in the county's response to make sure that all of our residents are addressed, that the public safety is our first and foremost concern. With that said, our presentation will begin with an update by Carol Osterberry, the health officer, who will give the view from the Public Health Division. Then we will have an update from our Senior Services Director, Lisa Whitmore Davis, to tell you about the impact and changes that had to occur with the Meals on Wheels program. Then we'll have an update from Kwesi Betsarai with regard to our veteran services. Then you'll hear from Jennifer Caruso with regard to our clinical services.
Please, anybody on this call, mute me. Now I'm unmuted. But yeah, please, people, we do a lot of these meetings. You know you need to be on mute. All right, Ms.
Okay.
Allen, I'm sorry.
Yes. Clinical services, and under that presentation, we will address the jail medical services, medical services at the Juvenile Detention Facility, and the FQHC, which we still have one running in Hamtramck. Then you'll hear an update from Janetta Coleman with regard to juvenile and youth services, including our JDF custody side of the house and our other juvenile and youth programs. And then you'll hear for an update with regard to—
How would I know when that's been?
There are still too many people that don't have their phone on mute
kind of notification?
or their
Staff,
computer or
please
something.
mute the whole line. Staff, Sherelle, please mute everyone except Janelle.
And commission. Well, yeah, okay. You're right, Madam Chair.
Staff,
Yep.
Sherelle,
Hit them all.
hit everyone except Janelle right now.
Is she calling from a phone because I can't find her name?
She's calling from a phone.
Yes, I'm calling from a phone.
What's your number?
313-421-7592.
Okay, I'm gonna find it. Okay.
Thank you. And then we'll hear an update from Chris Johnson, who oversees the Health Choice Program, which also has a direct impact with regard to supporting our small businesses. And then if we have time, that I know that there was an update at the Ways and Means yesterday, but Kamal Kaparu is available to provide a financial impact update with regard to this department and the Senior Services Department as well. So without further ado, and because you are going to mute us, then Carol Osterberry will go first. And then once she's done, I'll let you know then who should be unmuted next. Is that okay?
Yes, I have to find Carol also. I'm not sure if she's calling from her phone either because I don't see her name.
Yes, she did call.
Hi. Can you hear me? This is Andrew Kandrivas. She got a 734 number, ends with 1460. If you see that, she's on right now, I guess.
Got it. She should be able to speak now.
Hi, this is Carol. Can you hear me? Hello?
Yeah, we can.
Yeah, we can hear you.
Oh, great. Okay. All set for me to go?
Yep, we're ready.
Okay, great. Thank you. Thank you so much. And it's a pleasure to be here in front of all of you and giving our update on our, all the work we've been doing. As Janelle said, it's been 6 weeks. I many times think it was a lifetime ago, but public health has been very busy, very active, just internally and also, really with our community. And with that, I start out, even before all of this happened, we were conducting education and outreach in the community. We did for our executive team, for our elected officials, for our staff, we were doing those PowerPoint presentations, education about COVID-19. We had also reached out to the community partners, long-term care facilities. Have you heard about this? What are you going to need to do? What about your cleaning and, protocol and isolation and quarantine? So we, really worked with our internal community, our external community before this all really ramped up, and that was all in March. And we had learned from China that, this disease really had a focus on the seniors. So we also really targeted a lot of our education outreach for our seniors. And we even were working with Lisa Whitmore Davis. We had a full training for the Meals on Wheels volunteers. What is COVID-19? How do you protect yourself? How do you protect that senior who you are delivering the meals to? That was where we, we honed in on that vulnerable population, and, that's where we hit the floor running. Then as cases started, our public health communicable disease nurses, they went into, okay, case investigation, this is how we do things. And, they've done that, they do their jobs well. And, but then as more cases have been coming in, so we have ramped up so that we have over 30 public health employees that have been trained and are conducting the case investigations. So it's a very robust team, working to keep up and make sure those thorough case investigations are done for all of the positive cases in that that get reported in that MDSS system. You know, some of the new obligations, you know, as I said, case investigation in a way is nothing new. Surely this volume that we're seeing, but also having to manually input data into that system, making sure that the race demographics, into those electronic files, that is some of the additional or new work that all of those case investigators have been doing. Then you have the governor's orders and, us following up with complaints on those. To be honest, most of our phone calls really have been coming with, hey, here's the governor's stay-at-home, stay healthy work order. We're an essential business. How can does this work? Is this process? Is this procedure? We need to stay in business, but does that work to have the safety of our employees and our community? And we have been also following up manually with the race demographics, especially for the cases of the deceased individuals from COVID-19. So then, and as I already talked about, now all of a sudden we had just all of this information, all this data, and we quickly realized, good routine communication, which we are doing every day now with those case reports to our, elected officials, municipal leaders. So every day it's that good report. I know you all are very familiar with it, the number of new cases, number of new deaths and total. So that has really been an evolving process. We've worked closely with the IT department and with the communications department to get that out very efficiently, expediently, and have accurate results. I'm going to move next on to testing. And, again, back early on, there were challenges with, limited testing. It was only, testing was only being provided at the state laboratory in Lansing. It was a nasal swab specimen that had everything of a 2 to 3, sometimes it could have been a 4-day turnaround time. And at that point, someone had to have a prescription from a medical provider, have symptoms, or a first responder or healthcare worker. Since then, there has been expanded testing and accessibility. A lot of the healthcare systems have come on board, offering testing sites, and then there's even a temporary testing site. I think many of you have heard about the Wayne State University Physicians Group. And they are doing testing for first responders in Wayne County. They have done that at different locations, throughout City of Detroit and Wayne County for those first responders and healthcare workers. Then we move into, the City of Detroit at the State Fairgrounds. Again, nasal swab testing, about that 3 to 4 day turnaround time. Someone must be symptomatic. City of Detroit first responders also, and we've recently been expanding that testing site to employees of essential businesses, and that's including Wayne County. And with that, no symptoms are required. So as you can see, testing has been, just really evolving. Then we also have those rapid tests, nasal swab, but someone must be symptomatic to detect the virus from those rapid tests. And then City of Detroit first responders, and then they've also been just a wonderful, wonderful partner with us and allowing our county sheriff's deputies for return to work clearance. And I can quickly go through two. We've had the private business partners. Walgreens has a new testing site in Detroit, Walmart in Southgate, CVS in Dearborn, MedPost Urgent Care in Livonia, and Michigan Medicine, which is out in Canton Health Center. And where, even as I said, we've developed so much, then the state of Michigan has a very interactive web link, which we also have on our website. So you push on the button on the website. It takes you to a place where you put in your address, and it will then populate all of the testing locations that are near you. And that is routine. That's always updated by the state. And then if we hear of new testing sites, we make sure that all of that information gets on that site too. That is, it's just worked out very well for keeping everyone updated on, you know, the new testing sites that are up and what the requirements are for someone, you know, to get tested. It doesn't list like just the address is what I'm saying. Okay, then we've got those public health orders and compliance checks. The governor has all of their executive orders. In addition, under the authority granted to the health officer by the Michigan State Public Health Code, 2 public health orders were issued, one for child care centers and one for essential businesses, because we felt those 2 groups needed some additional requirements. Big thing being with employee screening for employees coming in, health screening, and so in addition to that, then our staff have been going out and doing unannounced, unscheduled spot checks to ensure compliance, be it from restaurants, daycare centers, and other essential businesses with the governor's orders and with our own local orders. So, as I said, earlier, our most common observations is adherence to all of these orders. I think people, in this community really took this very seriously and wanted to, protect themselves, protect their employees, protect their customers. So that's been very good. Another area, I think some are wondering, well, what have we been on furlough? Or what has the public health department been doing? And I can tell you, employees have been given access and they are working from home, access technology equipment, training, so that they are still providing services to the public. Some programs they've never missed a beat: WIC breastfeeding services, our Healthy Families America home visiting program, our Early On program, Safe Sleep program, and Children's Special Health Care. The staff has been able to, a lot of times it's been like with remote, like a FaceTime appointment for the WIC program. The state WIC guidelines very quickly, when all this was happening, said, yep, WIC recipient does not have to come into the office to receive benefits. So none of our WIC clients have had a miss in benefits, and that has really been a very well-oiled machine, and has been working very smoothly. Our clinic, we have had reduced for immunizations, but again, the HIV and sexually transmitted disease programs have continued again through that whole telemedicine model, and we are looking to, as things begin that transition of opening up, providing immunizations, maybe on like a limited appointment only, basis, so that we aren't missing anyone who would need their immunizations. And as I said earlier, all of the public health nurses are trained on case investigation, which is really where the bulk of our work is coming in right now. A few last things: personal protective equipment. Multiple times each week, Wayne County, and that's not Wayne County Health Department, but Wayne County is receiving personal protective supplies. They are received by the Homeland Security Department. We have a really good relationship with them over at the warehouse in Southgate. And then personal protective equipment is dispersed for healthcare systems, long-term care facilities. There is a Region South Health Coalition that coordinates with Homeland Security on then getting all of that personal protective equipment out to those locations. And we also have the personal protective equipment getting out to the, emergency medical response groups, local law enforcement, and we are also working with Homeland Security in my office for and I keep saying the full word, but PPE, going out to elected official departments and the executive offices. So, we're getting all of that out. As it comes in, it goes back out. And then I think the last thing that's on all of our minds is, how the reopening, and how are we going to, reopen Wayne County government, our community, our county here. And as was said earlier by Dr. Schmidt, community spread of this virus is still here. So, we're working with the economic development group and good public health guidance from CDC, because everyone wants to, see us get back to, I guess I would say like normal, but yet we have to be safe. We have to be very aware that community spread of this disease is still amongst us. So everything from, as I said, even earlier, remotely working from home. It's keeping you productive and working, but you're safe. Environmental cleaning procedures, personal protective equipment, social distancing, all of these things be maintained so that we can, again, transition into, coming back to, I don't know that we'll ever be back to, life as it was before COVID-19, but, a more of a normal sense. With that, I am done, and I think, if I'm wrong, I think then we are just moving straight on to Lisa Whitmer-Davis.
No, we're going to take questions for you for this section, Ms. Osterberry, before we move on. We're going to go section by section. And maybe I'll jump the gun here. Is questions about nursing homes, is that best to you or to the senior citizen department?
That'd be me, yeah.
Yeah, okay. So we'll go to questioning. I know commissioners will have questions about the senior homes. So be ready on unmuting yourself or whatever. First up will be Vice Chair Commissioner Baker McCormick.
Thank you, Mr. Chair. Thank you, Miss Ostenberry, for all the work that you're doing. I know this pandemic has really caught all of us, and I know you're doing the best that you can. As far as race, demographics, you talked about earlier a little bit about that. And in particular, my district in Northwest Detroit was the hardest hit, 48235 and 48219. And is that the data that you have collected also provides evidence of that, of this district being the hot spot? Where's that information coming from?
Hi, yes, and realize that what we are entering into that Michigan disease surveillance system is for all of the communities except for the city of Detroit. I can say that we are, again, going through confirming all of the race data that is in the cases under our jurisdiction is correct. Unfortunately, I cannot speak to those 2 zip codes in Detroit. I apologize.
Okay. And as far as a prescription needed for testing, if you don't have a doctor, how are we handling those individuals that don't have doctors?
Right. Someone can contact our office. Also, many of the testing sites now are not even requiring the prescriptions. So the best thing would be because the most updated information is on the website for what the requirements are for that testing site. But certainly if there is an individual who needs assistance with, like you said, getting that prescription, we can help provide that.
Okay, and would the website that you're referring to is the same as the finding the locations as well?
Yeah.
Okay,
yes.
Is that Wayne County site, or when you say the website, is that Wayne County?
Yes, it is. So you go on our WayneCounty.com website, and right up on the front it says coronavirus, and you click on, where the coronavirus, and then right there on that front page it says testing site, and you click. I mean, it's it's really very easy. And also, like I say, it's not just here's the address for the testing site. It gives all of the description as to what's required. But we certainly can help anyone if they need help navigating through that.
Great. And then last question, as far as the essential services and restaurant food services, what are the requirements of the workers? I mean, what are you looking for? Is it wearing masks? Is it just washing hands? What are the requirements?
Right. There were no new requirements for workers, so it is the same requirements as, before all of this, as far as, the gloves, hand washing, hair protection, all of that is the same. And then we are also going in and making sure that under the governor's order, that the facilities are just having carry-out service. So that's the extra piece.
Okay, so it's I guess my concern is if you're serving food and we don't know whether the individual serving food or preparing the food has the virus or asymptomatic. We don't, so we're not doing anything on that level.
Oops, sorry, I was on mute there. Well, and also one of the requirements under the food law is that sick employees are not to come into work, and I forgot to mention that. So that part has not changed. And as we've said from the beginning, if you're sick, do not come into work. And yes, that is something then that we look at when we go in.
Okay, but no testing on every worker that comes in, because again, we could be dealing with asymptomatic employees. And even on the county level, when we return back to work, should we be testing all staff, all employees to determine whether some folks are asymptomatic?
Right, and I hear what you're saying, but yeah, that has not been for the rest. No, that was not a requirement.
Okay, thank you.
You're welcome.
Thank you, Commissioner. Commissioner Anderson, you have questions on this section?
Yes, thank you. Carol, the nursing homes, are we initiating or is there something in place already about checking with nursing homes to see, first of all, I guess training to prevent additional cases, training on how they're supposed to be dealing and isolating patients that they already have that may have tested positive, that are not hospitalized or sent out to the hospital. If you could give us an update on what's going on with the nursing homes and assisted living, whatever rehab.
Sure. And we actually have one of our public health nurse managers, and she is the focal point, or the first primary person who is handling the nursing home cases. And we find that that's really smart to have that one manager as the primary first employee who handles what is happening at a facility. And you are exactly right, Commissioner, what you said. It's everything from you have the patient, and so then the isolation and the quarantine of sick residents. No group gatherings, such as even puzzles or games. No meals in the in the dining hall. Meals are all in the individual rooms. Proper hand washing and sanitation and all for the employees as well as the residents. No unnecessary or unessential visitors coming into nursing homes. Having the hand sanitizer stations. We go over all of that with them, and are there right from the beginning on, and make sure that they are following all of those guidelines, protocol, procedures for care in a long-term care resident setting. Absolutely.
I guess what I'm wondering too, is there a way that if someone has a patient in the nursing home or a facility that's unable to get information on their loved one, or they feel though they may be sick and not getting the help, is there any number they can call? Because I didn't see anything on the website, but I don't know if there's, if we could get something on there, or something distributed to our offices, it might be helpful too if we get a call on it.
Oh, okay. I don't quite understand, as far as, yes, we certainly can. Yeah, whatever, we're there to assist certainly the residents, the facility, and, family members if, they need information. So, I think that's what you're asking. Absolutely.
That is, and because I know I've heard some that feel as though they're getting the runaround from the folks in the office who may have, this has happened, and they just weren't prepared for it whatsoever, as I think a lot of us weren't. And
right,
so
right.
I think there's a lot of them that need to speak to someone, to ask them to, I guess, be an intermediary to try to get some information about their loved one that's there.
Yes. Okay, I see what you're saying.
And I know there's some, I can't remember, I think it was a particular county or state that had basically issued some sort of, I hate to call it a report card on some of the facilities, but it indicated how many folks were patients that had been found to have COVID-19. So they would, if they're in the process right now of trying to determine a place to place their loved one, I know most would advise to try to keep them away from a facility, at least for now, but some people don't have that choice. And I think they might like to have some type of guidance as far as what the outbreak, where it's serious, where it's not been a problem, or as far as reported cases. That's what I'm thinking about too, is if we have anything like that, has there been any thought given to that?
Yes, and and also nursing homes are, and I'm sorry, that's my dog in the background. Nursing homes are licensed through LARA, through the state. So yes, we're coordinating well with them.
Okay, maybe Laura might have that information, or might provide that information, or a hotline or something where people could reach out to them.
Right. I've made notes here. I'll have to look into that.
Okay, I appreciate it. I got a couple of more. The testing sites, I could not find it on the site. And I think it's a larger problem that we have with the site itself, trying to find certain things. It's not very intuitive, our website. And I know it evolves as things are added. A lot of times it causes issues. I couldn't get to the site you were talking about, the test sites. And I'm on the site with the novel coronavirus heading on the top with the symptoms and everything. But I don't see anything that says anything about testing.
Right. I mean, you and I could talk one-on-one and I could walk you right through it.
Okay, because it's hard for me to find. I'm thinking a lot of other people are having the same issue. I don't know if any other commissioner has found it, but it's something that I think we've got to, when they
Yes, I just found it, Commissioner.
Okay, because I'm looking at it right now and I don't see anything that says testing.
I had to search for it as well, but I did eventually find it. So,
like I said, I know it's not Carol's. Carol, I know you're not the web designer, but we've got to have somebody to take a look at our entire site, I think, to make it more intuitive and easy to maneuver and navigate. But that's a different issue. But maybe someone can direct me to that. I'd appreciate it, Carol. Maybe later after the call. But I know from what I understand from what you said, the comments we have. Sounds like one additional site in Western Wayne County. and when I say Western Wayne County, I'm talking about west of Telegraph Road, because just to get to Telegraph Road is a challenge for some people out in Western Wayne County all the way to Canton Township, and certainly in in Inkster and other areas, we need some testing out in this area. And I'm just the last time I had checked, the only thing we had was St. Mary's Hospital in Livonia, and I think there's a need for an outreach, maybe to CVS, see if they'll do it out in this area. The county is, if I'm not certain about this, but I don't believe the county is directly doing any of the testing, correct? They're partnering with other organizations.
Right, that is correct.
Okay, and I'm not sure if the other counties are doing that, but I did ask yesterday when we had the conference call or the meeting actually with EDC, that if we can use part of that $3 million, $3.3 million we got from the feds, why not? If we can do it, why not use it for some of the testing? And so I would ask to, I'll look at the sites, but I implore those of you that are in the process of trying to set up sites to make sure we have more in Western Wayne County.
Right.
Because I hear Wayne State, I hear the state fairgrounds, I hear, and I realize the population in the city, but we can't forget about Western Wayne and Downriver. And I know Downriver has, I believe, one new site, Walmart or Sam's Club, but I think we need to pay more attention to that. But I do want to say too that I appreciate what you do all the time, making sure through the person that sends it out, the updates. People appreciate that. And is there any difference between the efficacy between the two tests? Because I thought I heard that if it's not properly administered, the quick test may not be as accurate, but I may be wrong. Maybe it was. Do you know if there's any difference in the efficacy of the two different tests?
You know, I have heard the longer test, because it's a different test methodology, has like that higher accuracy, but both of the tests have accuracy levels that are acceptable through the FDA. FDA is the one who looks at the test methodologies and then gives the approval for all these different tests. And I maybe missed it when I was going through, because I have so much, Commissioner. Yes, the county is researching about procuring a test machine and kits, both for county employees and then, looking even at antibody testing for employees and the public. So we are very aware of the whole testing issue and are working on that.
Okay. And can you give us an update on the discovery of bodies at Beaumont and Wayne? And I realize maybe they're in the process of still investigating what happened.
Right. That is where, that is at. But I can tell you that, yes, my health department staff were over there yesterday.
Okay.
So that's at Beaumont Lane. I'm sorry.
Now, right. Okay. That's all I have right now. Thank you.
Thank you, Commissioner. Commissioner Dobb, do you have questions on this section?
Commissioner Harris, Mr. Chair, I'd like to have a question on the nursing home issue.
Mr. Haydes, in just a sec, Commissioner Haydes, we're going through the committee members first, and then folks that are not on the committee will have the opportunity once committee members are done, if that's okay with you, sir.
Thank you.
Just trying to keep it organized a little bit. Commissioner Dobb, do you have questions on this section?
Yes, I just have one quick question for Carol. I know that we're still conducting restaurant inspections, and a lot of people are happy to support their local small business restaurants while this is all going on. Are inspection reports available to the public online anywhere?
You know, those full inspection reports, yes, they were online, and what we're doing are these spot checks for, you know, compliance with the governor's orders. I'm just not, but yeah, the inspection reports are available online. Again, now that to me is even a little not, you do have to kind of dig deep into the website. They're in the same place they always were, under Health and Human Services Department, Environmental Services, I think.
Okay. All right, I'll try and find them, and if I can't, I'll find you.
Oh, yeah, please. Yeah.
Okay.
Yeah.
Thank you very much. That's all I had.
Thank you, Commissioner. Commissioner Marecki, do you have any questions on this section?
I do. A few things. Thanks, Carol, for the update. You mentioned that there's testing sites right now where you don't have to have any symptoms. So what is going on with that? How many days out of having your first symptom could someone test for a positive COVID?
Okay, so you're saying someone has symptoms.
Doesn't
right?
have symptoms. Doesn't have symptoms.
Does not have symptoms. I honestly don't know.
Okay, because you put up a slide that said one of the testing facilities, you don't have to have symptoms. So I'm wondering, I thought at the beginning these tests did not register you had it unless you were symptomatic for the disease. So I don't know if they've gotten better or they're finding out some information. I'm just wondering how many days out.
Yeah.
Okay, and you mentioned that the broad antibody testing is you're working on that.
Correct.
Any news about any kind of vaccine? I follow the national stuff, but have you guys heard anything about
yes.
vaccine stuff?
Yeah, we have not.
Okay.
Right, we have not, no.
Okay. And I'm gonna, this might be getting too much into the weeds, so I might have to just call you, but I just want to give you an overview. As you know, Livonia has had more deaths outside of Detroit than any place else. And a lot of those are in the nursing homes here. And we have 28 facilities, which I think we're one of the highest numbers, I think, in all of Wayne County, maybe the highest number. 13 of those are nursing homes and 15 of those are nursing homes and 13 are extended care facilities. So Livonia is doing kind of a creative program with these nursing homes. They're going in and making sure they're using the PPEs correctly and et cetera. Two things.
Oh. Mm-hmm.
Yeah, and I will send you what they have sent out to the nursing homes. And our planning director and the chief, the fire chief are heading up this program. The one thing that they do need more of are gowns and the point shoot thermometers, like big time. And because they're worried about the employees coming in and out, and the fire department is making a lot of runs to these nursing homes. The other thing is, and again, maybe I can talk to you offline so I'm not boring everybody else on this. They're working with this Dr. Gatt, who's going to be the chief medical officer at the Showcase facility. And they're looking at taking their nursing care patients when they get out of the hospital and still, are testing positive or symptomatic, of taking them over to the Showcase area. There's 250 beds over there, and using that facility so that the patient doesn't have to go back to the nursing home until they're 100%, so they're not bringing it back in. Because many of these nursing homes do not have areas that are, sanitized or completely isolated. Not sanitized, but isolated. So they're looking into that, and I don't know if they need the okay of Wayne County to, even though I know Lara oversees the nursing homes. Does Wayne County need to give them permission to do any of this kind of thing? Do you know?
Yeah, I mean, through Lara, and I'm so sorry.
Sorry.
Through Lara, and then, you know, they would contact us, Laura would contact us. But yeah, we can, I'm not really, you know, intimately familiar with what you're talking about.
Okay.
Certainly, if you want to get in touch with me, we can, you know, make sure, you know, just if there's anything else they need from us.
Okay. So do you mind if I call you so we don't spend too much
Oh, sure.
time on
Yeah,
this?
Yeah.
Okay. And the good thing is your phone number is right on this. So I have your phone number.
Yeah, and I'm excited to hear more about the piece with Livonia. Yeah, that's exciting too.
Yeah, it's very creative, and they're hitting each facility. So I think it's really going to help out. Okay, I'll call you later. Thank you.
That sounds very great. Okay, thank you.
Thank you, Mr. Chair.
Yeah, thank you, Commissioner Marecki. Other commissioners that are on the line, not on the committee, that have questions, I'll go to Commissioner Haydes first.
Thank you, Commissioner Killeen. I have a concern from past experience about the nursing home. Is the state have a program to do inspection on those nursing home, and the complaint I have in the past is they didn't do inspection enough to make sure those nursing home do the thing in the right way. In fact, in my community, when I was mayor in Wayne, we shut down one of them because of the excessive violation and how they perform the services to the senior citizen. The answer was they didn't have enough inspector to go more than one time a year and sometime every year and a half. So now this issue now became more dangerous because the spread of the virus. I want to know if the county and the state have enough inspector and people to go around to see if those nursing home, they doing the right thing. And what's scare me, there's so many deaths in the nursing home that telling me they very reckless. They not following the procedure with distance, with put the mask and the gloves. So my question is, do Wayne County have enough inspector, or we have the authority to do the inspection on those nursing home?
Yes, Commissioner, we do not have the authority to do the inspections at the nursing home.
Right.
We can certainly take.
Right, because
right.
I want
information if you have a complaint about one, and make sure that is forwarded back up to, and it's Laura, State Department. I can say that I have not heard of any staffing shortages from Laura. I have not heard of that. So, but certainly our role would be to, if there were a complaint about a nursing home and someone could not find, where to file that complaint, our office can certainly help. But no, the health department does not have the authority to go into that nursing home and do an inspection.
Well, it's my point here. And then sometime, the complaint come too late when you have 13 or 14 deaths in one nursing home. I think this point, it need to be addressed. And I think we, with the chair, the Health and Human Resources, Mr. Killeen, I think we need to bring that to the state's attention, as we need more inspection on those nursing homes to make sure they comply with the rules and regulation. If not, you're going to see more death in those nursing homes.
Anything else, Commissioner Haydes?
No, thank you.
I will talk to the chair of the commission. I believe she's on the line. Perhaps a letter to the state, to our state reps and state senators, as well as Lara, the governor, expressing those concerns about our nursing homes is probably what's in order here, Commissioner Haydes.
Yes.
Yes, I
Okay,
think even
any-
correspondence to Lara would be well worth it to let them get a little bit more of a handle on what's going on here in Wayne County. So we'll work on that with our attorney.
Mr. Chair,
That sounds great.
Thank you.
Yes.
Great.
to that point, this is Marecki.
Yeah.
I don't know if you all read the Free Press and the Detroit News articles today. The governor had, I think it was an executive order a couple days ago about how Lara now needs to start reporting the cases and reporting where these cases are in the nursing home. Because before, our officials could not even see what was going on, didn't even know what cases were going. I think if I'm right, Carol, you only could report like respiratory cases, that type of thing. But the governor just did this order, and both those articles today are pretty interesting if anybody wants to take a look at it. But they're opening up what Lara can do and should be doing. And so I just wanted to point that out. Thank you.
Yeah, I've
To
seen those
that
articles.
point,
Thank you.
To that point, Mr. Khalil.
Commissioner Haydes?
Yes, thank you. The impression of the public on the street when it comes to health and the nursing home, they think it's Wayne County's responsibility. And anything the nursing home fail with, they start calling us, where's your health department? What's Wayne County doing? And I know for a fact they have no authority to go and do inspection in those facilities. It's the state and Laura's responsibility. I want to make those points clear to the public to put the blame what it should be go to. So I appreciate you and the chair now gonna bring that to where we take some action based on that difficulty. And thank you.
Thank you, Commissioner. Any other commissioner not on the committee with a question or two?
Commissioner, it's Ilona Varga.
Yeah, Commissioner Varga, please.
Thank you. I have a letter in front of me from one of the nursing homes. They had a patient who had come down with the virus. They had taken that patient to the hospital and then was transferred to a diagnostic with the corona somewhere else, to a recovery center. 3 of their workers have also tested positive. Now, they knew that these 3 would infect the rest of the workers, as most likely some of the patients as well. Can you tell me what is in place for this particular, I'll give you the name, Applewood in Woodhaven. What are they supposed to do with this information once they have it?
Yeah, Commissioner Varga, this is Carol. I guess I'm a little, who would be getting that information? I'm not sure what your question is.
What would be the protocol for that nursing home once they have a patient who has been tested positive, was hospitalized, and also 3 of the staff who work there has also tested positive. So aside from having protective masks, what else are they supposed to be doing? And are they supposed to be testing? They should be testing the rest of the people who are in the nursing home. Is there a protocol for testing once someone has been diagnosed in that nursing home?
Right. Nursing homes now, again, under another, order from the governor, yes, nursing home patients that even have mild symptoms can be tested. And then, as far as protocol, when, those employees would have all gone through full case investigation from the public health, depending on where they live. The public health department does the full case investigation. They're positive. They would be, taken off work And as far as then the protocol for the nursing home when that positive patient, because I think you said that patient then was not returned back to the nursing home, right? So then it would be the cleaning, disinfecting, any of the close contacts being moved to a different area so that they would be not potentially infecting like other residents. All of that goes into the proper procedures for that nursing home when someone is positive and or when employees are positive.
Well, I think the problem becomes it's not Wayne County, but the problem does become when we know someone has been tested positive, they come in contact with another person, another patient, and we wait pretty well until somebody else gets sick in order for us to know what's going on. So testing is so crucial in these nursing homes, especially in close proximity to the one who tested positive in the first place. I'm probably preaching to the choir on this, but I'm really looking forward to having more guidelines come out by Laura, and I will check with them on this as well. Thank you, Mr. Chair.
Thank you, Commissioner. Any other commissioner have a question?
Commissioner Baydoun?
Yes, please, Commissioner Baydoun. Questions for the Wayne County Health Officer, Ms. Osterberry.
Thank you, Mr. Chair. Carol, thank you. Thank you for everything that you're doing to keep us safe in Wayne County. I have a couple questions, Carol. The first question, I was asked this question several times. When the Wayne County Health Department issues the daily reports, can they, for example, for the city of Dearborn, can they break down the cases by the zip codes? Is that possible?
Instead, the cases for that, how we are doing it is by the geocoding of each address. So that's where then that report splits out by, it puts it for Dearborn or Dearborn Heights.
So like I get the report every day, for example, like let's say there's 20 new cases in Dearborn. How can I tell how many of those were in the 48126, how many in the 48124?
Right, and I know other counties are just doing it by zip code. Instead, our model was to report by the municipality, and like I say, then that geocoding. I can ask the IT team about zip codes.
If you don't mind, I'd like to, if you can provide me with a breakdown of all the cases in Dearborn, which zip codes they belong to. And the other question, Carol, I was also asked this question several times on social media when I post the report. As we start talking about reopening the economy and going back to work gradually, people keep asking about the social tracing. When we start testing, does the Wayne County Health Department have the staff and the capabilities to conduct such a thing, or you need the help from the state and from the federal government to do the social social tracing? That's the terminology they use.
Right, it's that case investigation, contact tracing. It's how some people refer to it. Yes, but as I said earlier, we have really geared up with a very robust group of staff at the health department, to do all of that. And, every community in Wayne County, every community has positive cases. It is here within our community in every single city within Wayne County. And so it is here, there is community spread.
Okay, thank you again, Carol. Mr. Chair, thank you for allowing me to ask these couple questions. I have to respectfully exit right now. I have to go get ready for my town hall meeting tonight. But thank you. Stay safe, everyone.
You too, Commissioner. Thank you. Any other commissioner with a question?
Mr. Chair, this is Terry again. I have
Yes.
one more question.
Yeah, of course, Commissioner Moretti.
Carol, so Mayor Duggan was able to go into all these nursing homes and do all this testing. Why is that? Is that because they have their own health department? I mean, the city did. Why was
Right, and they have the rapid testing machine. As I said, that's what we're looking into getting.
But he had the authority to go in there, right? And so will we have that authority to do the testing in the nursing homes, or just the inspection you can't do?
I as far as, well, okay, I honestly don't know if my opinion, this is just my opinion, it would have not even been that authority. I think it would have just been like an offer. And they, I've never heard that it was anything that the city of Detroit did as like an authoritative requirement.
Okay.
You know, I was under more the impression from the city of Detroit, you know, health department, that it was, you know, an offer that was accepted. So, and like I said earlier, we are looking to try and get, you know, rapid testing machine ourselves.
Oh, okay. So if we were able to do this logistically, we could be able to do something like that in a nursing home. We wouldn't have to go through Lara to do it.
No.
Okay, it's more the inspection.
Right, Lara does those inspections, yeah, because they're the licensing agent.
Okay, thank you.
Mm-hmm.
Thank you, Commissioner. And I think as this bill is going through Washington right now and hopefully signed in a couple of days, I believe there's something in the order of 75 million set aside in the bill for testing. So hopefully Wayne County will get some testing money. Carol, I have two kind of high-level pandemic kind of questions for you. Commissioner Marecki earlier raised the issue of knowing the denominator in what we're dealing with here. Is it, from a public health perspective, Ms. Osterberry, is it fair to say we won't know what that denominator is till we truly have widespread testing?
That is correct.
And the other thing is, you know, because the head of the CDC is already firing a shot across people's bow about what next fall and going into the winter is going to be like. And I'm sure we will have discussions in this committee as we go over the next few months, because we're going to have a whole another kind of a ramp up of our health department going into the fall. This is the way I look at it. We are still to tamp this down and to put an end to the COVID emergency. We are still, I would estimate, 3, maybe 4 months away of having good treatments, not cures, but good treatments that are being studied all over the country in labs right now for helping patients. But we're also, well, they use 12 to 18 months for a vaccine to be developed. And this thing's not over until we have a vaccine, correct?
Yeah.
Yeah. So, and 12 to 18 months seems to be, yeah, that's if we did it in record time. So we are going to be facing this until better treatments coming in a couple of months. And is that about the right time frame you see on that, given your...
You know, right. You know, I mean, I hear, you know, like you do, a couple months, you know, 3, 4. I agree with you. I think there's a lot in the, you know, medical community that are, you know, really, you know, gearing up to, you know, get those treatments and, you know, get them approved.
So I do think we got to think in the terms of 2 to 4 months to get better treatments out there that will help. But until we have widespread testing where we can stay on top of where the hot spots are so that we can deal with those, that's the whole thing with testing. So getting widespread testing and better treatments, that will help enormously. But this is not over until, let's just say 14, 15 months from now, until there's a vaccine that can really get this under control and give comfort to our citizens out there when they start thinking about moving around again. Is there anything I said there that's wrong, Madam Health Officer?
No, and that's what I've been hearing, you know, and then you hit the nail on the head.
So, well, thank you for your time today. Very much thank you for the comprehensiveness of the report. I think I'll go back to our COO, Janelle Allen. Janelle, what do we want to deal with here next? As we give her time to unmute. I believe we want to hear from Ms. Whitmore Davis and the senior department.
Can you hear me still?
Yeah, go ahead.
Yeah, no, this is Carol. I think, the next up was Lisa Whitmore Davis.
Oh.
I don't know if she's on,
Yeah.
I don't know where her phone number is.
All right. Well, if we can get Ms. Davis on the line and hear from our senior department.
Good afternoon, everyone. Thank you, Chairman.
Yeah, good afternoon. Thank you very much. What do you have for us today? And please, folks, follow your outline that you got. I think it's up on the screen, or follow it on your email. So, Ms. Davis, the floor is yours.
Thank you. Thank you. Again, good afternoon to all of the commissioners and those who are on the call. The response of the Senior Services Department to the COVID-19 pandemic has been an evolving process. As we use the analogy, we're building our bridge as we walk across it. But our main focus is to ensure that we are compassionately and safely serving our Wayne County seniors during this pandemic. I want to speak on the overview that you have before you. I want to go first to the operational impact. Due to the COVID-19 safety protocols that we've been working with our colleagues, with Carol and her team at the health department, we had to transition our entire program from a daily delivered program Monday through Friday, a hot prepared meal that was packaged by volunteer effort and then delivered by volunteers. We had to transition that entire format to a once a week delivered by volunteers, receiving that bulk food pre-packaged and in a frozen state. That way we could ensure that we would provide our seniors with their traditional 5 meals that they get from us every week, but also in a safe way, because we could not maintain spatial requirements and social distancing. And then when the additional shelter-in-place order came in place, delivering once a week was the safest and the most compassionate way to ensure that we provided that nutritional support to our seniors, but also protected our volunteers. As many of you know, our volunteer base is about 900 individuals who are in that age bracket of 65 to even high 70s who participate in delivering our meals. Not only did we made those changes to our home delivered meal program, as well as our halal program and our liquid nutrition program, so that everyone is receiving once a week and frozen meals. The Congregate meal program had to cease meeting in the Congregate format due to social distancing and the shelter-in-place order by the governor. But what we have developed is a drive-up Congregate meal program where individuals who participated in the Congregate meal program in the past, they no longer come to the building and sit together, but they drive up in their individual cars, and volunteers place the 5-pack frozen meal in their trunk or in their back seat of their car, and then they leave the site. So that way we were still able to provide nutritional support to our Congregate meal participants and any individuals who are over the age of 60 that present to us and state that they need nutritional support during this pandemic. We're operating those drive-up sites in 24 sites across Western Wayne County. And I can email that list to you, Mr. Chair, and share it that way so that you can have those 24 sites. But again, with our safety protocols, that's our secondary piece, making sure that our volunteers are safe, reminding them and going over the safety protocols on how to maintain social distancing when they are delivering, when they're picking up the food, as well as when they're delivering it to an older adult's home. We've provided them with PPE, face masks, gloves, and sanitized wipes every week when they come in. And we really want to appreciate all of the support that we receive from our furloughed employees that are delivering anywhere from 200 to 300 homes weekly, as well as the United Way reached out to our administration, and Ms. Allen connected me with the United Way, and we have a volunteer team that deliver for us as well. So that concludes my part of the report, Mr. Chair.
Thank you, Ms. Whitmore Davis. And I would appreciate that list, but could you, where the congregate meals are, could you send that to commission staff so that all commissioners can get that list? Might be the easiest way to get it around.
Okay.
Thank you.
You're welcome.
We'll go to questions from commissioners. Commissioner Baker McCormick, do you have questions on this section?
No, I don't. Thank you.
Commissioner Anderson? Do you have questions, Commissioner Anderson, for senior services? Okay, I'm going to go to Commissioner Dobb then. Commissioner Dobb, do you have questions on this section?
Thank you, Mr. Chair. I have no questions.
Thank you. Commissioner Marecki?
Nope, I have no questions either. Thank you.
All righty. Any other commissioner that's on the line have question for senior services?
No, thank you.
Well, thank you again. I'm sorry, who was that?
This is Hedis. I said no, thank you.
Oh, okay. Thank you, Commissioner. Well, thank you, Ms. Whitmore Davis. Are the seniors able to handle taking frozen meals home with them?
The drive up, yes, it's a box with 5 frozen meals in it. So
I mean the seniors themselves. Do they all have the capability of cooking those meals up?
You just put them right in the microwave. There's a protein, a side, a vegetable, and they're in a 3-part compartment.
So you haven't gotten any feedback that says, hey, I can't cook this stuff, I need it a different way?
No, we haven't. To the contrary,
okay.
Commissioner, we've received several handwritten notes in our mail in the last week or two thanking us, and also I've received calls talking about how delicious they are, but they also are thanking us for not forgetting about them and being able to continue to serve them through this difficult time, unprecedented time.
Well, I think commissioners, and the next time we have a chance for a report on this, I think commissioners would love to see a few samples of the feedback that you're getting.
Sure.
So with that, thank you so much.
Thank you.
And I'll go back to the CEO, Janelle Allen. Do you want to introduce who's next for a report? I believe it's the Veterans Department.
I'm trying. Hello, can you hear me? Can you hear me?
Yep.
Yes. Okay, good. Thank you. So yes, next would be the Veterans Department, Kwesi Betsarai, who's the division director, and Kwesi would give an overview of how now his staff are still supporting and serving veterans remotely.
Okay, just quickly before we go there, for you, Madam COO, I don't know if Ms. Osterberry is still on the line, but there is going to be some money available through this latest.
Oops.
I lost
I'm
you.
still here. I'm still here.
Okay. I'm here also.
I can't hear
We're gonna be-
Commissioner Clayton though. Oh,
There we
it is.
go.
Okay. I'm still here.
We're going to be applying for some of that funding, right, under the new bill, so we can do more testing.
Yeah, I'm so sorry. You blanked out a lot, but
Yeah.
I think I know that what you're referring to is additional testing. Yes, we will. And as Carol did mention earlier, that some of the money that has been designated, we definitely are exploring, and that we are anticipating buying our equipment. So, and tests where we can test employees as well as residents. So yes, any funding available for testing, I believe we will absolutely be pursuing.
But that'll be a limited amount of testing. It's going to be the state or the feds that are going to have to do the widespread testing or fund us to do that.
Yes, I think overall, if you're saying for our community, but right now for the immediate need, we really are trying to explore options of where, one, that we could get a machine that can actually be large enough that they can have enough tests that we can run every day, and also having a sufficient quantity of testing kits where we could test employees and, again, would have some available for the community.
Okay, but the operative word there is some. Okay, we need more
Correct.
funding.
That's,
all right.
yes.
One more time, then, Miss Allen. Will you please introduce who's next?
Sure. Kwesi Betsarai, Division Director for the Veteran Services Division.
Hello. Good afternoon. Can you hear me?
Good afternoon, Mr. Betsarai. We're ready for you. And commissioners, please follow on the outline that you received the points in this report. So with that, Mr. Director, please take it.
All right. Good afternoon. It's good to see a lot of these familiar faces on this Zoom call. It's a new normal here. Got a couple notes that aren't on there, but we have developed some remote capabilities. All of the staff that I have that I had on hand are now working remote. You know, as you know, we've fielded countless calls from veterans and their families that require assistance with rent assistance. That seems to be a very big request right there due to a lot of the veterans being laid off. So we're working on getting them the rent assistance. There have been quite a few veterans that have died during this period. We're focused on giving the veterans some of the burial assistance monies that they've requested, as well as utility bill and water payment information. Initially, when this started, we had a lot of veterans who didn't know what to do because they were furloughed and their checks stopped, or they were working based on overtime. Those monies aren't available anymore. So we've really been focused on taking those phone calls, listening to our veterans, informing the veterans, and serving the veterans during this period. I'll tell you, we've had a lot of calls, as I explained to veterans, that we are not physically open, that our office is not open, but we are open remote. And I can just tell you, yesterday morning, I was explaining to one veteran what this means is that he will have to use an email to send documents to us. And he said, okay, I got it. 15 minutes later, he called me back. He said, okay, how do I send an email? So along the way, we're explaining, we have to educate our base on how to do these transactions remotely. So again, we're listening and making sure we serve them in other areas we didn't anticipate. Historically, we focused on serving wartime veterans. We've been working with Michigan Veterans Affairs Agency to try to get a grant to serve some of our peacetime veterans in Wayne County. We've had a few calls, uptick in the calls for peacetime veterans needing assistance. So we're working diligently to work out that piece right there. And so essentially, we're just really open for business. I have worked closely with management and budget to secure monies for a lot of veterans that the grants were in before we took furlough. Those grants were processed. Monies have been picked up and distributed to those veterans. The same thing applies to the veterans that serve our veterans. I'm sorry, to those vendors that serve our veterans in Wayne County. So we've been busy the last 5 or 6 weeks. I've fielded quite a few of those calls, and now my staff, they're taking a lot of those calls along the way. But it is an opportunity-rich environment. We are focused on listening and serving our veterans. I can talk a lot, but I'm going to stop right there and just take any calls or any questions you may have.
Okay, thank you very much, sir. Questions from commissioners? We'll start with Vice Chair Baker McCormick.
Thank you, Mr. Chair. My question is in relation to the veterans that have passed away, and the outreach to those veterans and how you are going about that. Can you tell us a little bit about how you're maybe reaching out during, this pandemic in particular? I know it might be a little more taxing, but how are you going about that?
Well, we have not, of course, physically gone out and done any outreach. What we're doing is working with the veteran service organizations to make sure that they're aware that we provide those services for up to $1,000 for burial reimbursement. So that has been the crux of it for this point right now. It's just making sure we coordinate all our efforts with some veteran service organizations and just making sure we help them with that process.
Okay, and so are you working with the VA at all, or when you say veteran organizations, are you reaching out to them as well?
Yeah, it's not the federal VA, but we do have calls that have been sent to us from the VA. And what I was referring to is the veteran organizations. That would be the American Legion, the VFW, Disabled American Veterans, and there's some smaller organizations that have routed phone calls to us. And when we get those calls, we explain which documents we need to the veteran's family, and we collect them, and then we go ahead and start processing that claim for those veterans.
Okay, thank you.
You're welcome.
Thank you, Commissioner. We'll go to Commissioner Anderson for any questions you have. Did we lose Commissioner Anderson?
I think so. I don't see him on here anymore.
Okay, I'll go to Commissioner Dobbs then.
Thank you. I don't have any questions.
Thank you, Commissioner. Commissioner Marecki?
Thank you. I don't have any questions either.
Okay. Do you have a sense right now how much you're going to bust your budget, Mr. Director, given the...
No, I don't have an idea how many requests I'm going to get, but I'll tell you there's an awful lot of, it's just that, because, it mirrors the larger society. It's a slice of Wayne County, but a lot of them have been laid off. That's been the general message when they start their call. They've been laid off and they need some help. So I haven't got an exact tally, but I have written down all the calls I took out. I was prepared to kind of go through the metrics on it, but I've had quite a few calls pertaining to being laid off, and that's usually not the norm. So the veterans being laid off or furloughed has seriously impacted how they handle their household finances.
And we're able to supplement some of the costs, correct?
Yes, sir. We are more than able to supplement those costs. And I'll tell you what's exciting is when I was given the opportunity to get my staff, bring them back from the furlough status, they were really excited. They were chomping at the bit. I could hear it in the phone conversations. I can tell it from this morning in my quick huddle with my teammates that they're excited about the opportunity to serve those veterans. I'm glad they're on board because they had an awful lot more answers than I possess to serve our veterans. So it's exciting for me, having been through this. We're taking all the phone calls. It's really exciting to see that we have a group of people in Wayne County who are committed to going back to work and serving those veterans in Wayne County. So it's exciting for me.
Excellent. Let me ask it a slightly different way then, Mr. Director. Are we prepared as a county to spend the necessary money to meet all the needs as the requests come in, even if they bust the budget?
I would say yes. I mean, of course, pending a county commission's approval of anything extra from our normal budget, I would say that we have the monies to serve the veterans in Wayne County. There's no doubt in my military mind that we have the money to serve our veterans.
Okay, thank you for that.
Chairman, this is Kamal Keperu, Finance Director.
Mr. Keperu.
Towards the end, I'll go in a little more detail and for each division on some resources. But also, yes, I will have to coordinate with each of the directors how it directly would affect their budget. But I do have more detail towards the end.
Okay, I think we have one other report, Mr. I believe. if I go back and look at this. But yeah, I wasn't sure whether you had those numbers, Mr. Caparu, which is for veterans, which is why I asked it now. Let me see here. Yeah, we need the clinical services update, which would be to a large extent, well, our FQHCs as well as WellPath in the jail and what's going on over there. So if I can go back to the COO, Janelle Allen, if you want to introduce the next person to present, please.
Yes. Hopefully, can you hear me?
Yep.
Okay, so yes, next we'll hear from Jennifer Caruso, who is the Division Director for Clinical Services. And as Commissioner Colleen said, this division encompasses jail medical services, as well as medical services in the juvenile detention facility, as well as our adult community corrections and the federally qualified health clinics. Jennifer?
Excellent.
Good afternoon, everyone. It's Jennifer Caruso. Nice to see you all and hear you all.
Good to hear you. Thank you for being here today.
Thank you. So as far as the response to COVID-19, clinical services staff have been working closely with WellPath corporate staff to make sure their protocols are being adhered to within the facilities. Protocols include testing and the safety, which is PPE. The recent testing data coming out of WellPath, dated yesterday, last evening actually, 23 inmates were tested. 12 inmates were tested positive. There are 5 pending results, 6 negatives, and 2 of the 12 positives had been released from jail within 10 days of their testing. Protocol just communicated today by WellPath is now there will be a medical hold on all inmates in the segregation areas waiting test results and on all positive inmates prior to their release. So with that, the inmates are going to have an educational session with a healthcare provider prior to their release, receiving proper guidance about monitoring and treating their symptoms, as well as how to reduce the transmission of the virus to other people. So, you know, Tylenol for fever reduction, what to watch out for, any kind of self-isolation that they need to adhere to, and the use of PPE to reduce spread. We've also worked closely with custody to identify quarantine and segregation areas within the detention facilities. So all inmates suspected of being positive for COVID-19 will be housed in the segregation area at Division 3. Any inmate with positive test results will be in one of 2 quarantine areas within Division 3. We also work closely with the chief judge, the prosecutor's office, and the sheriff to reduce our census in the adult facility. As of today, we have 865 inmates. During that process, the jail medical staff, what they did is they conducted a thorough review of all the inmates' medical records to determine any individuals with underlying medical conditions that might put them at severe risk for the illness. Data were then provided to Judge Kenny. He reviewed the data and made a determination of his or her release. We reduced visitation in all detention facilities in accordance to the governor's executive orders. Again, some of those executive orders have been amended since the original, so we've adjusted our protocol according to the executive orders. Only essential visitors are entering facilities. That means vendors and staff responsible for operations. We are also conducting routine health screens of all essential staff and vendors entering any of the facilities. This has helped us to identify people with illness and triggered intervention from their healthcare providers. We are making sure there's adequate staff, medical staff around the clock within JDF and ADF. JDF medical staff are conducting all the health screens. We've bolstered our partnership with Quest Diagnostic on COVID-19 test kits at the FQHC. We expect a delivery of test kits this Friday, and we're going to begin testing at the clinic site next week. The plan for this first batch of testing is going to prioritize local first responders, their own staff, and then they plan on testing asymptomatic vulnerable individuals within the Hamtramck and Highland Park. Quest is currently evaluating all requests for reorders on tests. So what they're doing is they're looking at how many tests we've utilized in a week, right? We've deployed in a week. Based on that number, they're going to be replenishing supplies. The Wayne FQHC is not currently open at this time. However, after speaking with the executive director, Tom Kochas, they are very interested in testing individuals in other parts of Wayne County, including Inkster and Wayne and other Western Wayne areas. And I think as the supply chain continues to open up and the Wayne FQHC reopens, we hope to be an important stakeholder in testing at-risk populations in those areas. We have been working in close and constant contact with the executive office and public health, thank you, Carol, to develop our protocols and to ensure adult and juvenile healthcare staff have the supplies that they need for protection. Our FQHC staff has also been maintaining important critical communication from the Michigan Primary Care Association. So that organization provides critical resources, including PPE, governmental updates, and any advice on clinical guidelines throughout the COVID-19 response time. So just today, I was informed by the executive director at the FQHC that MPCA provided them with another opportunity to participate in expanded testing efforts focused on individuals in southeastern Michigan. The details are still in the works for this testing expansion, but it is expected between April 27th and the end of May that the funding is going to be used to test individuals based on state criteria, which is now including all people with mild symptoms. Testing is going to be conducted on existing and new patients of the clinic with an option to access next generation lab contract for fast results turnaround and free testing supplies for Medicare, Medicaid, and privately insured patients. As far as operational and staff impact goes, we have right now in the adult facility, we have some limited staffing capacity due to the illness of COVID-19. Right now, we have 28 healthcare staff, approximately 1/3 of their workforce are out currently. WellPath, as most of you probably do know this, has lost 2 of its primary jail physicians to COVID-19. Currently, WellPath has 2 rotating physicians on site, 2 on telemedicine duty, and 1 pending new hire. We are beginning to extend and enhance telehealth services through the FQHC at Hamtramck. Further enhancements will be made to improve the FQHC's telemedicine efforts through the COVID dollars recently awarded by HRSA. We have received 2 NOAs from HRSA, which will help substantial efforts within the community and the FQHC side. We have also established a recent partnership with Gleaners Community Food Bank, and the FQHC is going to be receiving about 100 food boxes.
I'm sorry to interrupt here, Commissioner Killeen. You just used an acronym that
Sure.
I didn't understand what it was.
Sure, sorry about that. Notice of award.
Oh, okay, cool. Got you now. Thank you.
You're welcome. We established a partnership with Gleaners Community Food Bank, and the FQHC will be receiving 100 food boxes to begin distributing to families in need in Hamtramck this week. As far as the adult community corrections side goes, we have continued our partnership with the Michigan Department of Corrections to ensure that services are provided to probationers. We have worked with the Administrative Jail Release Project to maintain daily mental health log that contributes to any decision-making of individuals that will be released. Let's see what else. I just don't want to read from this. We have some vendors within adult community corrections that have limited or temporarily ceased programming as a result of the stay-at-home order. As you guys all know, some of the nonprofits in the community, this has really impacted them. They have staff that may not be able to work remotely, or with the courts closed, they're unable to really process much of anything. So that's a little restricted on their end as far as what they can do. And then the budgets of some of these nonprofits are really going to be impacted as well by COVID-19. And that is my update.
Well, thank you, Ms. Caruso. Questions from commissioners? Vice Chair Baker McCormick?
No questions, thank you.
Thank you, Commissioner. Commissioner Dobb?
No questions for me. Thank you.
Commissioner Marecki?
Yes, I just have one question.
Sure.
Ms. Caruso, you mentioned, and this was mentioned at the beginning of our presentation as well, you mentioned about testing asymptomatic people. And my question is, how many days before someone gets symptoms can this test pick up? In other words, like, can they pick this up before the patients even have symptoms? Because we were always told you had to have symptoms to have it register. So has the test gotten better, or do you know the answer to that?
I do not, unfortunately, I can't answer that. And there are a lot of tests out there, and there are a lot of tests that are coming on the market and making themselves available to organizations. So I would need to get more information on that.
So
this is Janelle Allen. Can you hear me?
Oh yeah, Janelle.
This is Janelle. Yes, if I may I would like to get more information, but we do know now, I think what you're referring to is the rapid test. They say you must be symptomatic, but the test and I forget the technical name of it, the one that where they still all get the nasal swab, but where they're sent off and it takes a few days to get back, it can pick up the virus before someone is actually symptomatic. I'll get for you though, like how much of the virus must be in the person's body and evident for it to pick up if they're asymptomatic. But yes, there is a difference between the rapid test and the other non-rapid test.
Okay, so they are finding that they can pick it up before people even have symptoms.
Yes.
Okay, thank you.
And to that point, I just wanted to, go ahead.
Go ahead, Commissioner Baker McCormick.
Thank you. I just wanted to know, do we know that we can determine if a person is asymptomatic, do we know how long they will actually have it in their, in their system, that it's contagious? Do we know any of that at this point? Do you understand the question?
I think I do. I think I do. Do you hear me?
Yes.
So the current, and Carol, please join in as well, that under the current still CDC guidelines, that if they do not become symptomatic within 14 days, and they're considered cleared, and that if they later become symptomatic, the assumption or conclusion is that they then had another exposure. Again, if they will become symptomatic, and I think the data is still showing that within 14 days from a particular exposure.
So
hi, this is Carol.
That is correct. Okay, so you're saying that it's a virus that's in their system, and they may not have any symptoms. However, it does go away. It's not like the virus stays ongoing in their system.
Well, that's not exactly what I was saying. I thought you were to ask that if someone had been exposed, if you will, a contact.
No, I'm
You're referring to someone who you know is positive.
Yes, I'm referring to someone that is asymptomatic. Say they took the test and they found out that they had the virus, but they didn't know that they didn't have any symptoms. How long does that virus stay in that asymptomatic person's body that they can then transmit it? Do we know if it's 14 days still for asymptomatic person, or is it 30 days, or do we know that the time span?
I would have to defer to Carol on that one.
Right. And, you know, again, because this is such a new virus, per the CDC guidelines right now, they are saying that, you know, that 14 days. But, you know, this has been very, very fluid, and it is a brand new virus that we are all, you know, the medical professionals, that we are all learning about. So I could be saying 14 days today, and then my point being, you know, weeks from now, some different guidance could come out. But yes, it is that 14 days.
Okay, and so do we know of anyone that we have tested thus far that's asymptomatic, and then we went behind them and tested them to see if they still had it after the 14 days?
Not that I am aware of.
Okay, I would be interested in if we can test someone to kind of figure out if that virus is you know, with them longer than the 14 days. So I would be very interested in knowing that. Thank you.
Mr. Chair. Mr. Chair. Hello.
Did we lose Commissioner Colleen?
So.
He's still on. He's not muted or anything either.
Well, can I ask a question? Does anybody care?
My bad. I did have it on mute. My bad. Yeah, you lost me. Yeah, trying to go back and forth on all. Yeah, go ahead, Commissioner Marecki.
Okay, so Janelle, but okay, if we're picking up the COVID before the symptoms are being shown with the patient, do we know how many days before the symptoms start that the test can actually show that that person has got the COVID?
Commissioner, I would like to, let me verify that.
Okay. All right, thank you.
Yes, because you're right, though. You do have to have a certain level of the virus in your body to be detected. We'll talk with the medical director to see what that is, or at least what the guidelines say. Okay?
Okay, great. Thank you very much.
Sure.
Yeah, and that's the point I wanted to make too. It's the sensitivity of these tests. I believe some of the tests are testing directly for the virus, and I think some of the tests test indirectly for the presence of the antibodies that somebody has. But I think that the question right now is how sensitive are these tests, and are they able to pick it up at the very low levels if it's right at the beginning of an infection? So I think there's more to come on that as all the work is being done right now to make these tests more sensitive and to give us good readings coming out. Are there any other questions?
Oh, Commissioner, just because you did make a distinction between the test that tests whether or not you are positive or negative, and then the antibody test. And you're right, those are coming to the market. We are also exploring procuring some antibody tests as well. But like I say, that's when someone to test if you had it, even if you never got tested positive, to see what level of antibody that would tell that whether or not you had been exposed to a greater degree. And if you could then your body would fight that off if you were exposed to that same strain in the future.
But that's why we need both tests, because going back to Commissioner Marecki's comment about what the denominator is here, we need both kinds of testing to tell us that.
Yeah, we agree.
Anyway, yeah. Okay. Anybody else have questions on this section? I think we went around the horn then Ms. Allen, next I believe we have Dr. Coleman, is that correct?
That's correct. Yes, for juvenile and youth services. And in this area, Dr. Coleman will cover our custody side of juvenile detention facility, as well as the other juvenile justice provider side with our care management organizations.
Thank you. And Dr. Coleman, if you're on the line, you have the floor.
Thank you, Mom. I love you. Don't forget my heart. Yes.
I don't know if Dr. Coleman, she is at 313-421-7467.
Her name is right
here.
Her name is right here. She's not muted.
She's okay. She said, she just texted if they can unmute her. Let me see.
There's not an option to unmute because she's not muted.
Sorry?
There's not an option to unmute her because she's not muted.
I think she doesn't know to press the speak button.
Unless she's...
Maybe she has herself muted.
Unless she's like me and muted herself.
Right.
I'm texting her.
Okay.
Commissioner Colleen?
Yep.
While she's, she says she's using her phone. Maybe she's not. While she's figuring this out, you mind if we go ahead to Chris Johnson?
No, I
I'll
was
work
thinking
with her.
about that.
Help me figure this out, okay.
Yeah, so next we have
Chris. This is Chris. Oversees the Access to Care, the Health Choice Program, our two-party health insurance program, where we provide, we support health insurance where small businesses to offer to their own employees. And you'll see here from a business standpoint about how Access to Care and Health Choice has been able to really provide a positive impact to businesses in need. Chris?
Yeah, correct, Mr. Johnson. And I'll just comment at the beginning, Mr. Johnson, that the chair of the commission, Commissioner Bell, is the chair of the board for is chair of the board here, and I'm also a board member for this program. So, Mr. Johnson, if you're there, Mr. Johnson, you have the floor.
He texted me saying he was through Zoom and he could see, oh no, I'm sorry. He's on,
Can you
I don't
hear
know
me?
if you have a muted. Yes, is that Chris?
Yes. Can you hear me okay?
Okay, good.
Yes, we can, Chris. But before you start, Chris, I'm going to say again, please mute anybody on the line here. Please mute your phone. Mr. Johnson, you have the floor.
Thanks. Good afternoon. I'd like to give a little bit of background since Access to Care doesn't appear in front of this body often. The Access to Care Division administers Health Choice of Michigan, which is a municipal health facilities corporation. The major program that we run through Health Choice is the Small Business Health Coverage Program, which provides health coverage to our local small business owners, their employees, and dependents. As you can see on the presentation outline that was presented to the committee, the impact has not been major at this point, but it's expected to come and be felt in May. The reason that we're not seeing the impact at this point is that employers pay their monthly premium payments a month in advance. So their April coverage was paid in early to mid-March, right when the start of this pandemic occurred. We've been working with the small businesses as it's a difficult time for them, and we've been doing a couple of different things. We've been offering deferment of their May premium payments to June 1st for those that are requesting it. We've been working with economic development as they've been working with many of these small businesses and assisting them with loans. As part of our package to new businesses, we're offering a 20% premium rate discount for the first 2 months of enrollment. With our current businesses, we've sent out letters to those where we've been more flexible in our requirements. We're allowing laid off employees to keep health choice coverage as long as the employer recognizes them as active employees. We're also allowing employers who must terminate their employees from health coverage to be able to reinstate the coverage of those employees once they return to active employment without having to wait till open enrollment. For those companies whose employees are losing jobs, we provided a link to the Healthy Michigan plan so that they can apply for the extended Medicaid that was brought out with the Affordable Care Act. We're also asking our current companies that are experiencing difficulty in paying their monthly premiums to contact Health Choice, and we'll work with them on a case-by-case basis. We've also provided links to resources such as Economic Development, Small Business Association, and the Michigan Small Business Development Center. So that's pretty much where we are with Health Choice.
Thank you, Mr. Johnson. We'll go to questions, but before we do, I want to say to all commissioners that are on the phone here, this Health Choice product is an excellent product for small businesses for coverage. So as you're talking to your small businesses out there, and if they don't have, well, even if they have insurance, you might want to mention it to them for them to look at the Health Choice plan to see if that's a better plan for what they want to do. So we'll go to questions. Vice Chair Baker McCormick, do you have any questions on Health Choice?
No, I do not. Thank you.
Thank you. I don't know if we have Commissioner Anderson back yet, but I'll go to Commissioner Dobb. Do you have any questions here?
No questions for me. Thank you.
Thank you. Commissioner Marecki?
I don't have any questions. I just want to make a comment that I think it's great how you guys have rolled with this, and this has got to be really encouraging to the businesses that are having so much trouble. Thank you.
Yeah, well, we're going to find something out over this next month about small businesses and how many small businesses are not going to be existing. This will be one measure of that, people that can no longer keep their businesses going. Is there any other commissioner with a question for Health Choice?
Varga?
Commissioner Varga, please. Yeah, you.
Have we seen an uptick? Have we seen an uptick of people needing this insurance since the epidemic hit?
I wouldn't necessarily say we've seen an uptick, but we have gotten quite a few inquiries into the program. On average, we enroll about 20 new businesses a month onto the program. I think we've probably gotten about the 20 inquiries, so I wouldn't say an uptick.
Thank you.
Yeah, but we see more of the individuals worried about losing their coverage because they can't pay the premiums is what we're seeing.
Yeah, I bet. Thank you very much.
Any other commissioner with a question for Health Choice? Thank you for making yourself available today, Mr. Johnson. I'll go back to COO Janelle Allen. Do we have Dr. Coleman with us now?
Let's see. Is she says she can hear. Yes, Dr. Coleman. She's texting. Well, how about I'll address this topic, because I think she's still having technical issues.
Okay.
Okay.
So we can go to Mr. Caparu for some budgetary information here. Is that correct?
Okay. That's fine. Or I could address this area. I could address the Juvenile and Youth Services update.
Okay. Yeah. If you want to go through that, then Ms. Allen, that would be great. Yep.
Okay. From an administrative viewpoint, like in other areas, there are certain criteria, and this is with regard to our youth who are in our first contact diversion programs, not in juvenile detention facility, that a lot of them require in-face or person-to-person contact. But like with other programs and areas, adjustments have been made to maximize technology and virtual platforms to stay connected with all the stakeholders, including in particular our care management organizations, Third Circuit Court, and our nonprofit contractors. And likewise with how was happening in the jails, we've tried to have lower our populations, our census in detainment, as well as in our other programs, that likewise that has been done to try to de-escalate youth from a level 2 to a level 1 to the extent that that was even reasonable. Dr. Coleman's still trying to get on. And so, again, all of the key stakeholders have been working together, again, to de-escalate youth, even those detained at juvenile detention facility or residential facilities, so that they could, to the greatest extent possible and that was safe, to be in their own homes. In particular with our, and then with our CMOs and our other nonprofit providers, that they have absolutely implemented emergency protocols with regard to be in full compliance with the governor's orders, internally with how the youth are in residential facilities. Certain those protocols are implemented. They have continued to intake and do admissions for new delinquency cases and doing all of their regular responsibilities with regard to case management, the therapeutic and assessment services of existing cases. So services are still continuing. They have been engaging with the families and the youth, though virtually, as well as with the Third Circuit Court for hearings and reporting. And I'm sure everyone knows, just in general with the Third Circuit Court, probate court, my understanding is pretty much all courts except a number of district courts have engaged in virtual hearings and proceedings. And so that has been occurring at this level as well. Over at the juvenile detention facility, we have implemented a number of protocols beginning.
I'm sorry, Ms. Allen. People, can you please hit your mute buttons? Please hit your mute buttons. Thank you. Go ahead, Ms. Allen.
Sure. Shortly after the first case in Michigan and in Wayne County was identified positive case of COVID, on March 14th over at the JDF, they started doing the mini health evaluations and screenings for both the residents and staff. They clearly are adhering to the CDC screening recommendations. So they have implemented and did this early on with no visitors, except that those are required. And you may recall that back in mid-March, the governor did issue an executive order prohibiting visitors, I believe, in jails and at the juvenile detention facilities. However, a few days later, she rescinded her order. And in Wayne County, we just did not think that was wise. So we had the health officer, Carol Osterberry. She utilized her health officer authority to implement a no visitor, except for exceptions of medical providers, I believe defense counsel, just really required contacts were prohibited under a health officer order, and that order stands today. Under as of March 20th, they have been adhering to the Wayne County Emergency Management Rule for the JDF with regard to safety measures and visitor suspension. That's when they re-implemented the no visitor rule again. They have absolutely also installed operational safety protocols. As I believe a couple of weeks ago, actually implemented a protocol where all staff must wear a face mask when they are interacting with a youth. There was a concern that with their youth, that if they were going to be contaminated or going to be transmitted, it was going to be from someone coming from the outside because they have been detained. So they're going to extremes to try to protect the youth from being cross-contaminated by staff. So they require masks, that you must wear a mask when you're interacting with the youth. And they require, or they strongly urge all staff to wear masks throughout the day. But if you're on a break or you're not with the youth, it is discretionary, because I don't know if those of us who have been wearing masks like that, they can be uncomfortable. They also don't fit nearly as properly with a person who has facial hair. So our folks are closely monitoring that, again, doing everything to minimize or totally avoid our youth from being exposed. And I believe that pretty much covers the high level. So I'm prepared
Okay.
to answer questions.
Yeah, before we go to questions, early in this section, Ms. Allen, you referred to somebody being either a 2 or a 1.
What level? Yes.
Yeah, for
Oh,
level.
so-
Can you quickly explain what that is so people understand?
So yes, a level 1 is probationary status. So a youth could be involved in a first contact or diversion program. A level 2 is for residential facility.
And there's a formal process to go through to be changed from a level 1 to a level 2 or a level 2 down to a level 1?
Yes, and
Or
I'm pretty
however
sure
you
that
look.
is through the, yes, I'm pretty sure that is conducted through the court process.
Yeah, the courts have to. Okay. We will take questions on this section, starting with our Vice Chair, Commissioner Baker McCormick.
No questions, thank you.
All righty. Commissioner Dobb, you have questions here.
No, I don't. Thank you.
Commissioner Marecki,
No, I don't. Thank you.
any other commissioner on the line that has questions about this? Not hearing that. Are we testing people as they leave the jail, as they leave the juvenile detention facility? Are they getting tested before they go back out to the community?
Commissioner, I would have to verify that because I think they also are using the protocol of are they symptomatic? But
Okay.
I would verify. I don't know if that's being done automatically if they're not symptomatic.
And do we have any numbers for how many cases have been detected in the juvenile detention facility, either from our guests or from the staff that's there?
So from, we actually, I will have to confirm. Oh, Shanetta says she's in now. Shanetta,
Hi.
can you answer that question about how many
Hey, Dr.
staff have
Coleman.
been, great, how many staff have tested positive or who have been reported positive? I forget. I know we have had a few.
Yes. Hi, good afternoon, everyone, and thank you, Janelle, for giving my report. I've been trying to get unmuted here. So far, we have sent away through our mini assessment process, we have asked probably 6 people not to enter the facility because they did not pass our mini health screen, meaning that either they had a high fever or a cough, or just weren't feeling well, so they weren't allowed into the facility. However, we were notified that there has been approximately 3 people who were either in contact with someone or maybe one person who may have tested positive since the testing has been going on. But not a lot of people at all, seeing as though there are a lot of folks in and out of that facility on a daily basis on the 3 shifts.
Okay.
Shanetta, there was also a question as to whether or not when the youth leave the facility, are they being tested?
So no, we are not testing youth because they have to be a certain age in order for them to have a test for COVID-19. Without parental consent, we cannot do that. But what we are doing at the recommendation of the state of Michigan, and this is new within the last maybe 5 to 7 days, is that we are doing a daily respiratory test to see if the young people are presenting with any difficulty breathing at any given day and time. I do want to also add in terms of the other things that we are doing. So as Ms. Allen spoke to, anyone who access our facility, whether it is police bringing in young people who may have been arrested for detainment, the staff who come and go on all 3 shifts, regardless if they're coming in for their shift or leaving out for a break and returning back to the facility, they have to go through this rescreening and this mini evaluation every time there's an entrance into our facility.
Okay.
We do that for any detainee. If a detainee is presenting with symptoms, then they are asked to be taken to the hospital. If someone develops a symptom once they're in the facility, then we do have protocols in place where we are actually putting them in isolation or rooms isolated away from the other detainees, as you know, until we know that those symptoms are not reminiscent of someone with COVID-19.
Okay, so is that true then, Dr. Coleman? On intake then, we can't test the youth unless they have permission from a parent or guardian?
So there's no testing allowed for the youth. But
so we're
monitoring them to see if they are presenting with respiratory issues, but we're not administering any COVID-19 tests.
Would we ever, we are doing some sort of screening as the youth come in?
Yes, we're doing a mini health screen, meaning that we are also doing the touchless temperature, asking the questions that are recommended by the CDC. So we're not doing the swab in the nose and throat.
So if we don't like what we're seeing on intake, those individuals then go to this quarantine area in the juvenile detention facility, or is there somewhere else outside of the facility they go?
If those are symptoms like coughing, a fever, or something of that nature, they are not allowed in the facility. So those young people are asked to be taken to the, to the doctor or urgent care or hospital. But anytime, just so that everyone knows, if a kid ever comes to the facility absent of COVID-19 and they present with gunshot wounds, broken bones, bruises, anything, they are not brought directly into the facility. The process is for them to go to the hospital to get clearance to come into the facility. So we're just following the same protocol.
I gotcha. And the judge needs to be notified in these cases?
Yeah, the judges are notified of any case that we have. Oftentimes, we've had this call too, so Ms. Allen spoke to what we're doing from an administrative perspective in terms of working with the Third Circuit Court. They are very well aware of what our protocols are as it relates to COVID-19, and they do agree that is the best and safest way to make sure that there are no one to bring anything into the facility.
Okay, we went around the horn once. Are there any commissioners that have questions for this? Oh, one other thing, Ms. Coleman, are we providing PPE to like our CMOs or any other nonprofit out there that are interacting with our youth? Is the county helping those nonprofits with their PPE?
We have not provided PPE to the care management organizations, but what we have done in terms of the technology side of it, with the governor's stay-at-home order, we are still providing case management services, but we are using virtual platforms to do that so that will minimize any face-to-face contact. So the governor's order will allow us to use platforms like Zoom and FaceTime and BlueJean and Google Meet or any other platform. So that is how we're making our face-to-face contact, not only for case management, but some of the providers are also doing that for assessment and for individual therapy.
Okay, sounds good. Any commissioner have any further follow-up questions for Dr. Coleman? All right, hearing none. I guess now, Ms. Allen, we're to the financial section.
Yes, we are.
And we have Mr. Caprou with us. And before you get going, Mr. Caprou, I think, there was a pretty good a layout of the fiscal situation in Ways and Means the other day. So I don't want to get too deep into the numbers here, sir. What I would like is at a high level, like where are we at with the Health Veterans Department in terms of a number that we think will be over budget. So if you have a general number for the different areas that we talked about today, about how much we anticipate being over the budget in these areas, the Commission's going to be facing a lot of very difficult decisions in the next couple of months as we try to close the $152 million gap in this fiscal year. So, Mr. Caprou, can you give us a general sense in these areas of how far over the budget we are?
Yes, sir. I appreciate that and hope everybody is well and staying healthy. I'm Kamal Caprou, Management and Budget Finance Director for the Department of Health, Human and Veteran Services. Really, you laid the context out Khalil Rahal and the CFO Huey Newsom gave a financial impact report yesterday. And on page 9 of that report, or that PowerPoint report for our department, we're estimating 2.7 million revenue reduction to the department. Now that number, I'm in the process of diving down deeper. So I like the quote from Miss Lisa Whitmore Davis that we're building the bridge as we walk. I say that in context because a lot of, in fairness to the directors on the call, they haven't heard these numbers because they're hot off the press. So to be clear, that 2.7 is the revenue, the estimated revenue reduction. That will not include the expenses, like our expenses that have increased since COVID-19. So that that amount could go up. So the next step is to work with the division directors or the division directors to see how that shortage is affecting each individual division. So that's really the next step, to work with the directors. I'll stop there.
Okay. Do we have a sense today of how accelerated spending is as a result?
I would say no to answer your question, because again, working offline or working offsite and gathering the data is a little slower. But I do expect, of course, public health and clinical service, which entails the FQHC. But actually across the board, because veteran services is kicking up and juvenile services. So it's just a matter of gathering that data. But like I said, the next step is to work with each division director from an operational standpoint, and of course share this data with them, and we go from there.
So we will probably get, in another couple of months here, very much deeper into these numbers as a budget is presented?
Most definitely.
Yeah, okay. Any of the commissioners have questions on finances at this point? Thank you, Mr. Caparu. Vice Chair Baker McCormick, you have any questions on the money?
No, I do not.
All righty. Commissioner Dobb?
No questions, thank you.
Commissioner Marecki?
Nope, I'm all set. Thank you.
Any other random commissioner that's out there lurking?
Varga.
You have a question, random commissioner from downriver?
Yeah, I just want to let you know that we are meeting offline quite a bit, sharing information, and Ways and Means maybe stepping up and meeting more as we go along, because we have to try to figure out for the next budget, well, not only next budget, but this year too, how we're going to handle all this. So there is a very intense following of the Commission Ways and Means Committee with the executive and the department. So just wanted to let you know.
So as chair of Ways and Means, Commissioner Varga, do you anticipate that the commission will hear through you and your committee as we move forward, as in terms of the financial situation, maybe even getting a few updates before we get into the budget process?
You will be getting a lot of updates as soon as we have anything to share that is more solid in the numbers. Then we will be sharing that. There's going to be a lot of budget adjustments for us to handle probably in about a month to try to deal with the shortfall for this year. So we're going to be moving monies around everywhere where we can find a contract that might be able to be renegotiated or that deems to be unnecessary for now. Those will be dealt with, and then we will make the budget adjustments to go along with it. So you will be hearing very soon and very often about updates from the Ways and Means Committee.
Yeah, and okay, that's good. You know,
All to myself. Yeah.
Say that again.
I think we're all going to be. I'm not holding this all to just our committee because I think it's important for all and every commissioner to be just as aware as the Ways and Means.
Well, I agree with that, and that's what my question was, because you know, this is like drinking out of a fire hose here today. And so, you know, just so commissioners know for in the future, most of the information around where we at with the budget will be coming to us through Ways and Means.
And Mr. Chair, I have to say that the executive office is working with the chairwoman, Chairwoman Bell, myself, Mark Abel. We're having meetings to let us know, put our heads together. So we're doing this together this year. So we started last year working together on the budget, and this year is going to be even more important, and we are doing it more often. We have 2 meetings so far this week on just that.
Okay, thank you for that. This is going to be one last call for any questions on the report that we've gone through for the last little bit here. Is there any Commissioner Baker McCormick, you have any additional questions?
No, I do not. Thank you.
Commissioner Dobb, same question.
Nope, I'm all set. Thank you.
Commissioner Marecki, same question.
I'm all set, and I appreciate the way that you ran this meeting today. You know, it's really, really nice to know when our questions were going to be, in what line we were going to be in. Thank you.
Yeah, drinking out of a fire hose ain't all that fun, so try to do the best we can. With that, thank you very much to the department for putting this report together from administration. Thank you very much, very enlightening. With that, we'll move the agenda. Madam Clerk, if you're still there, what's next on the agenda?
Such other matters as may be properly submitted before the committee.
I don't believe we have any of those. Does anybody have something popped up that they want to do? Hearing nothing, we move the agenda.
Public comments?
Do we have any public comment? Is there anybody from the public on the call here that would like to have comment? One last call for public comment. Is there anybody?
Mr. Chair,
Go
my
ahead.
constituent, Deb Sumner.
Yes.
Yep.
Deb?
Hello.
Yeah. Name for the record, please. And, you know, this is public comment, so you have a couple of minutes for your comment, and it's not a discussion back and forth. We will take your comment.
Can you hear me?
If it takes follow-up, we will get back to you. I can hear you. Can you hear me?
Oh, okay. My name is Deb Sumner, resident. Yes. Yes, I can.
Okay, go for it.
Yes, I can hear you, sir.
Well, it's your public comment then.
My name is Deb Sumner, and I'm a longtime. Yes, I think that there's technical difficulties in going in and out. But my name is Deb Sumner, and I am a longtime Wayne County resident. I'm here to implore you to do what you can to collaborate with the mayor of Detroit, their Detroit Department of Health, Area on Aging, the state, whatever you can do to get all residents tested in nursing homes and their employees. These locations, these enclosed environments are death hotspots. So in April, just in Wayne County alone, there was 94 deaths in the nursing homes. That excludes Detroit nursing homes. So we have no idea what the numbers are. I mean, there's more, obviously. To help identify the COVID-19 patients. There are employees that have been identified that have been tested positive. And for the protection of our most vulnerable elderly populations, we want to be testing them. We need to be testing across the nation, as you know. So that's what we need to do to protect them. My dad's 92 years old and is no longer living in Detroit at his home. He's now in the broader Wayne County area in Woodhaven at a nursing facility. I mean, it's an excellent place, but I mean, standard protocol. I understand there's a problem with getting tests. Maybe the mayor, he's supposed to nursing homes by the end of this week. Maybe he will help. Maybe he will take his testing device, start testing all of the rest of Wayne County's nursing homes. So I implore you, please help them. I think that's all. I don't know if you guys heard me.
Yeah, thank you very much, Ms. Sumner.
Sure.
Thank you very much. Is there anybody else out with public comment? Anybody else for public comment?
Sure. My name is David Holtz, a longtime Rye Mills resident. I just wanted to, well, first of all, thank you guys for having this meeting, and it's good to hear all this. Second of all, one of the reasons I was shouting out earlier about, are we seeing the signs in our institutions with the people coming with the COVID, if they have the neurological and the cardiac signs, because certain places are seeing it, some places aren't. But it also determines, how these are being categorized on the death certificate. So, are these people who, for instance, have a cardiac issue, but also have the COVID, are they being listed as a COVID death or a cardiac? So I'm wondering if our numbers are skewed or not and how accurate they are. And obviously the other thing that we always have to get interested in too with these numbers are people with autoimmune, which unfortunately a lot of people who don't realize they even have an underlying issue may have an autoimmune disease and are considered more vulnerable to this disease. And the last thing I want to say is I heard someone talk earlier, asked about how long this virus stays in your system. I've seen reports where they said that it's going to last in your system for up to 27 days and still be contagious. So there's still a lot to learn about this virus. We continually find new things about it, including the fact that it even does permanent damage to some people in their lungs. So this is going to be an ongoing experiment every day as we find out new things about this virus. Thank you again.
Thank you very much. Anybody else with public comment for the Health and Human Services Committee? Anybody else with public comment? One last call for public comment. All righty, Madam Clerk.
Adjournment.
Pleasure of the committee.
So moved.
Support.
That was Commissioner Marecki, supported by Commissioner Dobb. All in favor of the motion to adjourn, please say aye.
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 Aye. Any opposition? All right, we are adjourned, and thank you so much, everyone. Everybody stay healthy.
You're welcome.